How can the bladder stretch so much? Imagine a balloon that can expand many times its original size without popping. That's similar to how your bladder works. The bladder can stretch a lot because of its special structure and tissue makeup, which allow it to hold urine comfortably as it fills. This ability is essential because it turns the bladder into a flexible storage tank for urine, ready to hold anywhere from about 300 to 600 milliliters normally, and sometimes even more. The key to this flexibility lies in the layers of tissue that make up the bladder wall. The main muscle, called the detrusor muscle, is made of smooth muscle fibers arranged in both long and circular patterns. These fibers are woven together with elastic fibers like collagen and elastin, which give the bladder both strength and stretchiness. When the bladder is empty, the inside lining has folds called rugae, which look like wrinkles. As urine fills the bladder, these rugae flatten out, and the bladder wall becomes thinner, allowing it to expand without increasing pressure too much. This process is called compliance, which is the bladder's ability to stretch and accommodate more urine with only a small rise in internal pressure. A healthy bladder keeps pressure low during filling, usually under 20 centimeters of water pressure, so you don't feel discomfort or risk damaging your urinary system. The nervous system plays a vital role here too. Stretch receptors in the bladder will detect when it is filling and send signals to the brain and nerves. These signals tell the muscles to stay relaxed, allowing the bladder to stretch, and when it's time to go, the muscles contract to push out the urine. The bladder's capacity and stretchability are impressive but depend on healthy tissue and proper nerve function. If the bladder wall becomes stiff or damaged due to conditions like fibrosis, inflammation, or cancer, its ability to stretch can be impaired. This can lead to problems such as frequent urination, urgency, or incontinence, because the bladder cannot hold as much urine comfortably. In summary, the bladder can stretch so much because of its unique combination of elastic tissue, muscle layers, and nerve control. These features work together to allow the bladder to expand and contract smoothly, ensuring it can store urine safely and comfortably. Maintaining bladder health through good hydration, avoiding irritants, and seeking medical care when needed helps preserve this remarkable ability. If you have concerns about bladder function, always consult a healthcare professional for personalized advice and assessment.